Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. These are some of the highlights. Students in Lagos, Ogun and Taraba secondary schools ready to take up learning challenges amid the coronavirus as they resume school today. Still on education during the pandemic, primary 6 pupils in Bayelsa State, ahead of their common entrance examination, demand extension of study period, say 4 hours schooling time insufficient. The Nigeria Center for Disease Control (NCDC) reported 3 deaths in the last 24 hours in the following 3 states, Adamawa, Benue and Kaduna, increasing the fatality toll to 1,098. This is as the country recorded a daily count of 97 coronavirus cases, a sharp decrease from 221 and 189 reported on Friday and Saturday last week. The cases are reported in 11 states and the Federal Capital Territory, with Lagos recording the highest there at 46. While 138 patients were discharged in 8 states, the recovery count rose to 48,569 and the total active cases being managed stands at 7,575. A look at the COVID-19 figures from different states shows that the epi curve taking a downward trend. It also shows that the last time we recorded over 300 cases was the 24th of August, with 321 cases were confirmed. In the meantime, the NCDC says there is no scientific evidence that disinfectant tags, often known as Air Doctor, can protect people against COVID-19. It says that the composition and concentration of the active ingredients in Air Doctor is ineffective against the SARS-CoV-2, which is the virus that causes COVID-19. It says that chlorine dioxide and its products, which are contained in such tags, can lead to serious health effects, especially in children. Now, the Minister of State for Education, Mr. Chukwuemeka Nwajuba, has been monitoring compliance to the COVID-19 protocols and also inspecting school facilities in the Northwest Zone ahead of reopening. The Minister inspected some federal institutions in Kano before proceeding to the Federal Girls' College, Kazore, Jigawa, among other institutions, where he held talks with the Emir, Dr. Adamo, who advised on reforms to the education sector to curb the rise in the number of out-of-school children. A low turnout of students were registered in schools in Taraba State amid the coronavirus pandemic. A visit to some schools in Jalingo, the state capital, also shows low compliance to the COVID-19 safety protocols for school reopening. Some students who spoke to our correspondent expressed excitement to be back to their classrooms, but they also want their safety guaranteed.
Gates and classrooms under lock and key is what has characterized schools in Taraba State since March the 24th, 2020, when they were closed because of the coronavirus. 6 months down the line, schools have reopened and students flood the school environment thanks to the directive by the state government. However, only a handful observed the COVID-19 protocols, as most of them exchanged pleasantries without regard for the safety guidelines. Nevertheless, the parents are seeking for proper safety for their children while in school.
It is actually gladdening to see my ward coming back to school after a long while staying at home with me. Looking at the circumstance we are in, my advice to the school is that they should try and maintain all the protocols that are necessary to ensure that safety is ensured.
While the parents canvass for safety, school proprietors are thinking about the burden of aligning both third and first terms to ensure optimum results after the cancellation of the third term by the state government.
In dropping my children in the school, the staff of this particular school, they were there ready with some of the facilities that are being put in place to curtailing some of this menace that we are passing through, that is the pandemic.
They may find it difficult to cope with some topics because some topics are continuation. But we'll do our best. We'll do our best to see that maybe we can fetch the important topic and treat them in the first 3 weeks, and then we'll merge them with the present class. If this will work out, I think we'll be very happy.
In all of this, the students say they are excited to be back.
I've been at home for about 6 months now, away from my friends and everything, and it's a thing of joy to be able to come back to school and see everyone, finally.
I feel very good because now I can keep up with my education.
Reopening of schools is just a part of the phased resumption of normal life in a pandemic situation. The state government says it's not going to lower its guard in the fight against the coronavirus, and it's embarking on the monitoring exercise to check compliance.
As we resume schools, we will have our monitoring teams. The monitoring teams will go around the 3 senatorial zones. We have a team for Central Zone, we have a team for Northern Zone, we have a team for Southern Zone. All schools must follow the rules and regulations of the state government.
For now, compliance with measures against the COVID-19 is expected to be a continuous exercise in schools across the state to ensure the safety of students.
Meanwhile, primary 6 pupils in Bayelsa State are asking for more schooling time to prepare for their common entrance examination. Our correspondent Dobra Timiwood brings us this update.
I am at the Model Primary School Biogbolo Yenegwa in Bayelsa State, where pupils in primary 6th class have resumed academic activities.
I thank God that we are back to school again. But the period that they give us is not enough for us to revise our subjects. So I hope that the government give us more time.
We have been at home for 6 months and we have just learned for 2 weeks. So, and the date that they gave to us to write the exam is released. So I want to say that they should add, let me say, 2 weeks to the exam so we can learn what we have not learned before.
These are children that have stayed home for 6 months. All what we taught them before, most of them have forgotten them because of the period of time they were at home. Yes, the plans we have here is to this school, and speaking of this school, what we are doing, we ensure we keep them for more than when the government asks us to keep them, so that we can meet up.
As you can see, they are all wearing their face masks, and any child not wearing face masks is not allowed into the classroom.
We are now trying to do what they ask us to do, and as now we are trying, the spacing too is okay. Instead of 70 thereabout in the class, it's only 20 in the class. So by that, the spacing too is okay, and we are trying to see that nobody will be attacked by the disease.
There are 2 active cases for COVID-19 in Bayelsa State. The number of confirmed cases still remains at 393, and 370 persons have already been discharged from the isolation center. The state has recorded 21 deaths due to the coronavirus. From Yenegwa, Dobra Timiwood for COVID-19 updates.
Now, the Joint Health Sector Unions, JHESU, today resumed activities after announcing the suspension of its 7-day nationwide warning strike. The leadership of the union has asked the Assembly of Healthcare Professional Associations to return to work across all federal health institutions in the country. According to the national chairman, its next line of action will be decided in due course by an expanded National Executive Council. And he joins us now, Mr. Josiah Biobele-Moye, JHESU National Chairman from Abuja Studios. Thank you for joining us on the program. What informed this suspension of the warning strike? Have all or some of your demands been met?
Thank you, viewers. Actually, I wouldn't say our demands have been met, but we gave a 7 days warning strike, and the 7 days expired yesterday, midnight. So as law-abiding organization, we must keep to our words. Even if our employers are not keeping to their words, we will not go the negative way. Hence, we decided to call the expanded NEC, which also affirmed that we must keep to the law, and so we have suspended.
So because at the presidential briefing today, the chairman of the PTF commended the suspension, but is hoping that, there won't be a strike afterwards. So with regards to some of the demands that you've made, so far with the federal government, have you sat down to talk to them? Because, there is the allegation that the federal government sort of intimidated JHESU as a union to call up the strike.
Yeah, they actually tried to intimidate us. They intimidated us, but we are resolved, so we have to stay until the 7 days. They wanted to intimidate us to suspend the actions before the 7 days. And they felt because we have not suspended, they did not talk to us. But we are saying, like the PTF is saying, that they don't expect a strike. That is not, the ball is not in our court. They are the ones to prevent the strike from happening. I warned about this strike from July, August, that they should not lead us into temptation. But rather than attending to the things we presented, they decided to take the part of blackmail and intimidation. But I have also stated before now that JHESU members, unlike as they said that we cannot endure hunger, that we cannot organize strike, that we are ready for the worst if they push us. And so the expanded NEC has decided, because NLC, TUC actions are coming up. If not, we would have readily given, as we suspend, since the government did not do anything, did not attend to any of the issues, we would have given another 15 days immediately and then wait for the worst to come. But because NLC, TUC have their own activities, we have said we should wait for that to come and go. Then maybe by the first week of October, we will call our men back, and then we now review the situation, and then where possible, if the government feels that it is war that they want, that Nigerians are not, the citizens of Nigeria are not important, and so they are not sensitive to the plight of Nigerian citizens, that we stayed for 2 years and they still pushed us to go on to strike, we will take it up with them right there.
Finally,
we're not really shaken anyway.
Give us some examples of this intimidation you've spoken about or blackmail from the federal government.
Yeah, the first day of the meeting, as we sat, rather than facing the issues, the minister was saying that he will implement no work, no pay and all that. And no work, no pay has been just a thing that he has implemented for all the JHESU members. You are all living witnesses of within the industry, where strikes came up 2 times at the peak of COVID-19. And that no work, no pay was not implemented. But whenever it is JHESU, he now says he will implement no work, no pay. They can go to court and then use a court action to stop us. And then they can take a pseudo or mercenary NGOs to take a court to stop us with court actions. But we are saying the ministry, the government itself has disobeyed so many judgments in our favor. So this time, if they think that is what they will use in intimidating us, I have said it and I will repeat it again, we'll go to prison.
We'd like to thank you, Mr. Josiah Biobelemoye, JHESU National Chairman. Thank you so much for joining us on the program. We hope that things can be resolved amicably for all concerned in the interest of the country. Thank you for joining us.
Thank you so much. Thank you for giving us the voice.
The chairman of the Presidential Task Force on COVID-19, Mr. Boss Mustafa, has stressed on the need for more caution as Nigeria continues to reopen the economy. He says the call is pertinent in the face of the repeated disregard to the non-pharmaceutical interventions, including the wrong use of the face mask. Mr. Mustafa restated the need for travelers into the country to take the call for self-isolation seriously, saying that Nigeria cannot afford another importation of the virus. While commending JHESU for calling off the strike, he says he hopes the call-off is final, saying that this is not the time to show fatigue in the fight against COVID-19. In the meantime, for the Minister of Health, Dr. Osage Hanire, while noting that the daily cases of infection is on a downward trend, he says we cannot rejoice yet as there is still the need to conduct more testing. He's asking states to increase testing, saying that Nigeria is still very far from the 2 million testing target, calling for strong caution as many states plan to reopen schools. The Regional Expert Committee on Traditional Medicine for COVID-19, formed by the World Health Organization, the Africa Center for Disease Control and Prevention, and the African Union Commission, has endorsed a protocol for Phase 3 clinical trials of herbal medicine for COVID-19. Now, according to the Director of Universal Health Coverage and Life Course Cluster at WHO, like other areas of medicine, sound science is the sole basis for safe and effective traditional medicine therapies. Mr. Stephen Chubiyojo is a pharmacist and specialist drug quality control and drug production. He joins us from Abuja studios. Thank you for joining us on the program.
Thank you.
First, has Africa gotten, or rather, how far has Africa gotten in terms of clinical trials on traditional medicines for possible vaccines, for other diseases in the past?
Currently in Africa, in the time past, there had not been much that was done on our herbal medicines. But with the advent of COVID-19, it is sharing and quite interesting to know that WHO, the African Region Office, has approved a protocol for clinical trial for traditional medicines. And what this means is that there won't be any wild claim anymore. Because a lot of people in Africa, traditional medicine practitioners, keep claiming their herbal medicine can do so many things without scientific basis. So the Phase 3 clinical trial is to establish, 1, safety. Number 2 is to establish quality. Number 3 is to establish efficacy. And safety is the gold standard for drug production, drug manufacturing, everywhere in the world. So the same standard that is being applied to the orthodox medicine, the allopathic medicine, is the same standard that is being applied to the traditional medicine. So with the Phase 3 clinical trial being established, having a protocol being established for clinical trial for herbal medicine, it means that anyone that passes this Phase 3 clinical trial can be mass-produced and it will be approved by regulatory agencies within that country. For instance, in Nigeria, we have NAFDAC. And that committee that has been set up by WHO now will help to guide the committee, the regulatory authority in each country to ensure this protocol are strictly adhered to.
In terms of the initiative, working towards a herbal medicine for COVID-19, what are the chances?
Currently, it is interesting to know that NAFDAC in 2019, March 2019, had established Herbal Medicine Product Committee. And this Herbal Product Committee, what their responsibility is to check the efficacy of herbal medicines that have been submitted for a particular claim. Currently, we have about 40 samples that have been submitted to NAFDAC with claim of activities against COVID-19. That's quite interesting. So with these 40 items, NAFDAC is currently working on them to prove the claims of this traditional medicine practitioner. And among these 40 herbal medicines that have been submitted, it includes that of Professor Maurice Iwu, a pharmacist. He has a traditional medicine that he has submitted to NAFDAC with claim that he has activities against COVID-19. So these are all high-profile claims. And we believe that at the time NAFDAC is through with them, they will be able to go through their Phase 3 clinical trials. And once that is done, they will be approved for use in the larger market. In the Phase 3 clinical trial, there is comparison with the standard drug. And that comparison will help us to know if that drug can do exactly what it claims, what the practitioner claims it can do. With that in the pipeline, I think we're on the right pathway in Nigeria.
We'd like to thank you, Mr. Stephen Chibiojo, pharmacist and specialist drug quality control and drug production. Thank you for joining us on the program.
Thank you very much.
Now, countries around the world are still trying to grapple with keeping the number of coronavirus infections down, and the UK says cases are likely to go up to as many as 50,000 daily by mid-October if further action is not taken. This comes as Prime Minister Boris Johnson prepares to chair a COBRA emergency committee meeting tomorrow and then make a statement to the House of Commons. Here's more on the global update.
A new partial lockdown has begun in Madrid's working-class district of Vallecas, the morning after residents took to the streets to call for better health provisions, complaining of discrimination by the authorities. The lockdown measures predominantly apply to areas of lower income and with higher immigration populations, home to about 850,000 people. About 600 people demonstrated in the southern district of Vallecas on Sunday, which has one of the highest infection rates in the Spanish capital. Meanwhile, a stay-at-home order has taken effect across Yangon, Myanmar's biggest city, after the country reported a record high number of new cases. The region's more than 400 million people had less than 24 hours to prepare for the order, which came into effect on Monday morning. New Zealand has lifted all coronavirus restrictions across the country, except in second wave hotspot Auckland, as the number of new infections slowed to a trickle. Prime Minister Jacinda Ardern says some restrictions were also eased in Auckland to allow gatherings of up to 100 people, but the country's biggest city needs more time before all curbs could be lifted.
As you can see, our actions collectively have managed to get the virus under control. With no new cases in the country today and no new cases for 7 days linked to the Auckland cluster, we are in a strong position to make our next move down our alert settings.
New Zealand, a nation of 5 million, appeared to have halted community transmission of COVID-19 earlier this year. But a fresh outbreak in Auckland in August prompted the government to place the city back in lockdown. Belgium has passed the 100 milestone of infections following a sharp increase in cases in recent weeks, according to figures from the research institute Sciensano. The country has one of the world's highest per capita fatality rates from COVID-19. The Taj Mahal in India has reopened to visitors after 6 months, the longest it has ever been shut. The entire campus was sanitized before it opened, and officials were seen wearing masks and face shields. Authorities have also said there will be temperature checks at the entrance, and visitors will be asked to buy tickets digitally. The Taj Mahal will also now only allow 5,000 visitors a day. Before the pandemic, the monument drew about 70,000 people daily.
Take a look at our website. It has the latest update on the pandemic. All you need to do is log on and you will find those stories and several other stories as well on our website. It's channelstv.com. Thank you for watching COVID-19 Update. I'm Millicent Nwaka. Stay safe.